I know traditionally for most cases of epiretinal membrane, I'll go ahead and put in ICG at the beginning of the case and peel ILM around under the epiretinal membrane to help get an edge. But in some cases, the epiretinal membrane can be so dense and so pervasive that it's more important to really peel that epiretinal membrane first. And that's exactly what I'm doing here. This is just a big, thick epiretinal membrane across the macular surface. I'm going in here with some engrasping forceps and peeling off this epiretinal membrane. I really like to clean my forceps inside the eye. This avoids me having to come out of the eye, use a wipe and whatnot. So I'll just use a simple flicking technique with my light pipe safely off the macula in kind of the midvitreous. But you'll notice this here as I just kind of flip that little membrane off of there, and it keeps my instruments and my attention in the eye. So peel this very broad epiretinal membrane with kind of multiple attempts here, peeling it all the way across. You can see it's a very sticky membrane. It wants to fragment and come up quite a bit. But once I've got a significant amount of that epiretinal membrane up across the macula, now I put in my ICG, which will allow me to stain my underlying internal limiting membrane. And here, to my surprise, some of that internal limiting membrane has actually already come up on the backside of the epiretinal membrane. And I'm able to just get in there, grasp that ILM. This ILM after a membrane peel can be kind of tricky. Not uncommon to see some hemorrhages from where the membrane's stuck down to the macula in these very sticky cases. Of course, a peripheral depressed examination. And then as I do a lot of times, I'll leave these patients under air, and it helps with wound closure and just makes the case look a little bit better and not having to use sutures. Thanks so much for watching.